Welcome to David Game Horizon Pods. In this podcast, we will look at the role of our college nurses, both for day and boarding schools, but let's not forget our staff. With me are two of the college nurses, Michelle Everett and Nasima Begum.
Hello.
Hi, Michelle. Nasima, welcome. And before we start the podcast, I'm just going to ask you if you could tell me a little bit about yourselves, please.
Okay. Hi, good afternoon, Theo. My name's Michelle. I'm one of the college nurses, as you said. I've been a nurse for 30 years now, and every day is different. I've been really lucky enough to specialise in quite a few varied topics. I started off in paediatric burns and A&E and trauma. So I obviously had a large team next to me and beside me. I loved doing paediatric burns and trauma for a long, long time. I then got married and had 4 children who have all grown up and fled the nest now, but it changed my outlook on life, and I found paediatric nursing and burns nursing something that didn't really fit in with my family lifestyle. So I became a specialist in asthma and pulmonary rehabilitation, running education classes around Buckinghamshire, which is the longest, thinnest county, I think, in England. So it was a lot of travelling, but I absolutely loved it. It fitted in with my family a lot more. Yes. Lucky or unlucky, it's one way of looking at it. I was specialising in respiratory when COVID hit. So that was obviously very harrowing times, but teams pulled together amazingly, and I was very proud to be part of that and be part of nursing. The last of our 4 children left home a few years ago, so my husband and I decided to live out a fantasy of ours and move to London because we'd never done it before. I think our children thought we were having a midlife crisis, but now they've come round to the idea, and we love living in London. And I've become a college nurse, and I've been school nursing for a few years now, and I absolutely love it. It's part of a team with NAS, but also you're very autonomous as well. You don't have doctors and consultants and a lot of nurses around you for advice. You act on the spot. You use all your advice and your knowledge that you've learnt over the years of nursing. It's a very, very different role, very different to what I thought. It's definitely not a plaster on the knee and a paracetamol. It's much, much more than that. It's much more dynamic and diverse, and I absolutely love it.
Wow, absolutely fabulous, and a wealth of knowledge, and I think that's so important in order to come into this type of an environment, whereby you have to have that skill set,
absolutely,
and be able to address any of the school's needs. Nasima.
Hi Theo. So my career kind of started with healthcare assistant role. I worked in a hospital setting, and I got to really observe how a nurse would impact a patient and get to see how they help the recovery process. And I think that's when I kind of fell in love with nursing, and I thought, let's do a degree and go into this. I initially started off working on one of the busiest wards, and it was like a general medical ward. You got everything and anything. And I think I learnt the most through there because I got to work with so many people and a huge team. I eventually transitioned and specialised in neurorehabilitation. Worked there for about a year, and I think we looked after extremely poorly patients, and I learned as much as I could, and it was time for a change, and I really, really like a new challenge, and this is when I came across this role, and I applied to it as well. I think what I like the most about this role is meeting students and families from a range of different backgrounds, and you get to learn about the culture, but also help them with very different needs compared to in a hospital or clinical setting. And like Michelle said, it's very different to what people think school nurses are. It's not a plaster and a band-aid. It is a lot more, and hopefully we can go into that a bit later.
Great, lovely. Thank you, and welcome to both of you. Right, I mean, school functions on an academic year, and tell me about a typical day in the life of a nurse at this college?
Okay, well, as you can imagine, one day is never the same as the next day. They're all very, very different, aren't they, Naz? Yeah. It can range from emergency first aid and wound care to chronic long-term management. We've got quite a few students here that have chronic conditions. Quite happy to accept them and look after them. Education shouldn't be a limit to them at all. Asthma attacks, epileptic attacks, fractured arms, dislocations, exam anxiety, diarrhea and vomiting, flu. Every day is very, very different. For us, we work slightly different shifts. So I work 7:15 to 4:30 and Naz works 9 till 6. But we also cover nights and weekends. So the students are never without advice. We have an examination room and an observation room in the boarding house, and we also have one in the college. We also cover advice and do visits to several sites across London where a lot of our external students board. Obviously, admin, although it sounds boring, is a necessary part of our role. Yeah. And we order prescription and over-the-counter medications. We perform stock control. We assess pupils for self-medication competencies. We design individual healthcare plans for students. We also assist students in registering with a GP when they arrive here. And we are more than happy to attend GP appointments with them if they request that. We also organise dentist appointments, opticians appointments, audiology. And recently we've set up a drop-in clinic, which is proving very successful, and that's for staff and students twice a week. And we find it works because they can pop in for an informal chat and some advice without that pressure of an appointment. And we're finding that we're reaching out a lot more students that we hadn't necessarily encountered just because they pass that open door and think, oh, there's the nurse sitting there. I'm going to come in for a confidential chat and advice. And we found that really, really beneficial, haven't we? Yeah. But yeah,
Good.
every day's different.
Absolutely. So what happens, for example, if you're absent and you're not on campus?
Okay, so as Michelle has already mentioned, we are on call. So even if we're not physically there, we are just one call away, and house parents can reach to us whenever they need to. All of our house parents are trained on how to administer medication and give out controlled drugs. So in our absence, if a student requires, they'll have access to medications through the house parents. We also ensure that all our house parents are comprehensively trained on a range of medical conditions. We have given them access to guidelines, and we've created a booklet which they can refer to at any point. And that covers various conditions like what to do if they have an increased temperature, if they have a cough or a cold, a sprain, basic first aid, and you name it, it's in there. It also the guidelines work, so they work within their scope of practice and they're not trying to do what a nurse would do. If that's required, then they know to call an emergency service like 999 or 111 for help.
I assume these are all, there are notice boards, and all this information is on the notice boards throughout the college?
Yeah. So we have it on a notice board, and we have created like a folder, and all the guidelines are within that folder, accessible to the house parents at any time.
Excellent.
They also have first aid training, so they're either on the 3-day one or the 1-day one, but every single house parent has a form of first aid training, and they're level 1 and 2 safeguard training as well, so they know what to do in an emergency. And I think that's really good as well. Our house parents take our students on field trips. Usually it happens on a weekend, so we ensure that the trip box, the first aid box, the emergency allergy box, the burns box, all of it's up to date, and everything in there is correct and is ready for them to take out. So Michelle and I take turns. So Michelle usually does the individualized healthcare plans and sends it out to the staff that's taking the students, and that way they have the relevant knowledge on what to expect if anything were to happen.
Absolutely.
And like I said, we're on call, so if in doubt, they can just give us a call and we can give advice.
Well, excellent. Well, I'm very confident and comfortable that you're both here, because anything that happens to me, I'm in safe hands. So, all right. So, tell me, how would you include any forms of health promotion in your particular roles?
Okay, so we both do house training, don't we? In-house training to all staff and students in how to identify and treat things like anaphylaxis, using the adrenaline pens, how to identify asthma attacks and treat them, how to use the defibrillators, which we have several in the college, and how to care for someone suffering an epileptic seizure. We hold talks and assemblies, and we also offer one-to-one to all staff and students, giving advice on sex education, nutrition, exercise, the use of vitamins, dehydration, the amount of times a student will come to us with a headache, and we ask how many fluids they've had and they've not drunk all day. Really, really common for our students to be dehydrated. Yes. We also talk to them about resilience. And encourage them to download really helpful apps like the pollen alert for hay fever, which Naz will be talking about in a minute. Mm-hmm. Next term, we plan on joining forces with our PSHE lead and giving advice on the dangers of vaping and testicular health. Health promotion isn't obviously just physical, but psychological too, and we discuss panic attacks and teach strategies such as breathing exercises to combat this. Because we're both, boarding is still quite new to this college. We've touched on health promotion this year, and next year we're going to really, really push on health promotion because we're obviously the students' home when they're not at home. So it's a really, really important part of our role.
We're dealing with a lot of international students. Can we prepare those parents in order to then make sure their children are well equipped or ready when they transcend and come to the David Game College?
I think that's a really good question. We've got 5 points to address, and Michelle, please jump in if you think of anything as well. I think one of the main ones is parents should be aware that any nursing that takes place will be in the medical room or the observation room and not in the student's room. So students usually think that if they are unwell with a headache or let's say a stomachache or whatever, that we will allow them to rest in their room. And we don't allow that, not to be mean, but for their own safety. Yes. If they're in the observation room, they're under direct supervision. Yes. If anything were to happen or their health were to deteriorate, we would be the first ones to see and then react accordingly. So if for example, someone came in with an increased temperature, they might think, oh, it's just a temperature, can I just go rest? But actually that temperature can then lead to a seizure if it's not well controlled, or that period can lead to a hemorrhage, etc. So really requesting parents to speak to the students and support us when we say that students should rest with us and not in their room. Of course, we will assess everyone on an individual basis, and if they need to isolate in their room, then that's different. We will allow that, but we'll also check on them regularly to make sure that they're safe.
Excellent. Michelle? Is that?
Yep.
That was point one.
Point one.
Oh my, we've got 4 more points, yeah?
4 more points.
Off you go, don't worry.
So the next point is to do with understanding the danger of self-medicating. We completely understand why parents might send their child with medications, because I probably would do the same thing. But understanding why it's such a big risk is really important. Often the medication tends to be in foreign, or the ingredients are in foreign and we can't guess what they are. Yes. And the problem with that is you might have 3 medications and they will contain paracetamol. So without knowing, you've accidentally overdosed. So it's really important to refrain from bringing any medication with you unless they are prescribed. And if your child needs it, then please come and see us, because we have a range of medications that we can give. And if we don't have it, then we can arrange for it as well.
So an international student whose parents are abroad, should they then communicate through, obviously, the right process through admissions and then pass to you, so you know what medication they need? Yeah. And then can that be ordered from here? How does it work? How would that work?
If they email us or ring us, we can discuss what medications they're prescribed. They can then normally get their GP from their country to send a prescription to us. We will then take that prescription to the GP that we've helped the student register with, normally with an appointment. Things like iron tablets, a lot of students are on iron tablets, but it's, as Naz says, it's in foreign medication. So our GP in this country will normally organise a repeat blood test, or if the parents can send over blood results that show they're low in iron, our GP would just prescribe them in English. Excellent.
Yeah. Wow, that's extremely organised. Yeah, Nasima.
The next point is to encourage students to have a really good diet Now, it might sound silly, but oftentimes when students are coming here, it might be the first time away from home and they really think, yeah, I can eat whatever I want. But when they come to us, we see that they have headaches, and that might be because they've not drunk water the whole day, or they're falling ill really quickly and they're not consuming any vegetables or fruits. So just really encouraging them to maintain a good diet.
Yes.
And kind of touching on the topic we said before about supplements. So if the child does require iron supplements or vitamin D supplements, 9 times out of 10 we'll allow it and we'll let them take it, but we just need it to be presented to us, and it needs to just be in English, or the ingredients need to be in English. And we can arrange blood tests like Michelle said, and then they can have that. I think one of the really important things we need to push for is it's against the school's policy for anyone to have any form of protein powder or whey powder. And I know it's quite common with the boys. Some of our girls do it as well. They love going gym and they feel the need for that, but the school doesn't support that.
Right.
So we would be discouraging it.
Yep.
Good.
Also, touching on
Touch-
nutrition,
Yeah.
a lot of our students obviously do get homesick, and they do bring lots of goodies from home. Just for parents to be aware and educate their students, their children, that sometimes leaving, for us, unusual foods, international foods, 2 months on the side isn't
Okay.
quite the...
Yes.
Because they're used to being at home and someone else doing that for them.
I understand.
Just sort of making them more independent, really, and aware that, things go off.
But what about one of the most difficult issues is our weather?
Yeah.
So any advice to parents
it's-
when they're sending their kids over? Yeah.
It's really good you
from
mentioned weather.
from the Middle East or
Yeah.
some of the warmer countries.
Yeah. So I think we find that when they come from really warm countries to a country like this, where it's sunny in the morning and raining in the evening, students find it kind of hard to cope.
Yeah.
So just knowing what they're coming into, I think, is going to be really helpful, but also encouraging them to dress appropriately. I think sometimes we find students dressing for summer because it's summer period, but the weather doesn't quite reflect, and then they catch colds quite easily. Also, in the London, it's the pollen count is really high.
Right.
So hay fever is through the roof, and students that have never really experienced hay fever before might be experiencing hay fever for the first time here. And for them, it might be quite traumatic and very like, oh, what's going on here? I've never experienced this.
Yes.
So we'd really encourage them to download the hay fever app. Michelle has a favourite.
It's the Kleenex one, isn't
Yeah.
it? I don't want to advertise it, but it's a really, really good app, actually. It will just alarm in the morning saying high grass, high wheat, high
excellent.
pollen. It will just give you a heads up, really. And the students that have listened to our advice and downloaded it, they've just, it's really helped them, hasn't it? Really,
Yeah.
really helped them.
It helps them prepare for the day.
Yeah. Rather than coming to us in the afternoon and they've been streaming and coughing and sneezing, they've learnt to look at the app and go, oh gosh, it's high today, even though it's cloudy outside.
Yes.
I'll take my antihistamine now.
very
And when
good.
you look at research, children that suffer from hay fever actually have a grade less than they should be educationally because they suffer that much. So it's that important that it affects your education and your grades.
Wow. Well, I've learned a lot, and I'm confident now. And well, before we close, what message would you like to send out to our students, our staff, our parents, and prospective students? Michelle.
We're here, basically. Between us, we've got a wealth of knowledge, but two, we love our job. We're passionate about college nursing, and we're here. We're approachable. We will offer any advice. It's confidential. We're here to help. We're here. It's still now staff and students say, and parents, oh, we didn't know there was a nurse.
All right.
Even now. So it's really important to go, hello, we're here. Please email us. Please telephone us. And be reassured, parents, that your children will be well cared for.
Absolutely. And I'm sure this podcast will help to publicise it as well.
Oh, yeah.
I'm sure many people will hear it and be happy to listen to all the advice that you've given. I'd like to thank you both, Michelle and Nasima. And for more information on all of what we've covered today, please go to davidgamecollege.com. And thank you for listening.
Thank you, Theo.
Bye-bye.
Bye.